Welcome to Face on My Dream TV USA. This is your host Meeta Ramchandani from Tennessee, and tonight I have with me two very accomplished oncologists. I have Dr. Jigar Shah from Clarksville, Tennessee, and I have Dr. Pramod Ganta from South Carolina. Welcome to our show. Thank you so much for being here tonight.
Thank you for having us.
How are you?
Thank you, Mr. Ramchandani, for hosting this and inviting us to participate.
Thank you. So, Dr. Shah, we would like you to introduce yourself to our viewers and tell a little bit about yourself.
So, I'm a practicing oncologist and hematologist. I have a solo practice. My practice is located in Clarksville, Tennessee, and it's called Clarksville Cancer Care. I received my training from Cleveland Clinic Foundation, Cleveland, Ohio. And then, me being from Clarksville, I decided to return and practice here and try to give back to the community as much as I can.
Thank you so much. Pleasure to have you. Dr. Pramod, we would like you to introduce yourself as well.
Thank you, Mr. Ramchandani. I'm a graduate from India, Usmania Medical College, Hyderabad, and subsequently I did my residency at MCP Hanuman, and then worked as a hospitalist, that is internal medicine, and did my fellowship in University of Mississippi Medical Center. And I've been practicing medical oncology, hematology, and internal medicine in Anderson, South Carolina. Like Jigar, we've been friends for more than 18 years now. I was planning to get into oncology, and he kind of helped me. And then when I set up my practice, he was like, because he already went through all that, he helped me, in a lot of ways. And then here we are practicing oncology, as a solo practitioner.
That's great. Thank you so much, and it's a pleasure to have you both. So our topic for discussion tonight is healthcare insurance and the effect of COVID-19 on healthcare industry. So let me start with Dr. Shah. When it's time for enrollment, figuring out how to get the best plan with the lowest cost, your premium, your co-pays, your deductibles, it gets a little confusing. So how do we decide which is the best plan for our family? I would like both of you to answer that, but let's start with Dr. Shah.
So, thank you for the question. It is a difficult choice. I know when I was not a physician, I went through this process, and a lot of the things that I've learned in this profession, I didn't know at that time. So it is a challenging issue for people looking for healthcare insurance. So first thing, I'll tell you what I did, which was not the correct way of doing it. So maybe by giving my own example, I can set an example as well. So first thing I did was look at the premium, which is important, but at the same time, I would recommend looking at the long-term care benefits in terms of prescription coverage, in terms of autonomy to select your own physician and going for second opinion or third opinion, whatever the case may be. And also to look at the deductible and out-of-pocket cost. So for somebody who is young in their 20s and 30s, these issues don't really play, and they can afford to get a cheaper premium insurance unless they have underlying pre-existing condition. However, for somebody who has chronic diseases like diabetes, high blood pressure, or any kind of cancer or blood disorder, which is going to make them require long-term medical care, then looking at the out-of-pocket deductible, the back-end hidden expenses, pharmaceutical cost is very important. So copay, deductible, out-of-pocket, those are kind of standard expenses that patients nowadays are having. So a lot of the times what happens is the premium is a lot cheaper, but when the patient is being seen by different physicians, say multiple times through the year, those three components, the copay, deductible, and out-of-pocket, a lot of the times become more expensive than a regular premium. So I would highly recommend individuals to keep that in mind when they're looking for insurances, besides just the premium cost.
Right. Right. So, Dr. Ganda, we would like to hear from you as well. What about out-of-pocket costs? We know that when the monthly premium is lower, the out-of-pocket cost becomes high. And
Right. Thank you for the question. To expand on what Jigar was saying and to add to that, and also to answer your question, I would like to divide the insurance into two categories in the United States. One is patients less than 65 years age and patients above 65 years. So most of them who are above 65 are retired and have Medicare. So, and most of the patient population that is coming for medical care, I would say 70 to 75% is under this category. As we get old, we have medical problems.
right.
Right. So, what I would tell and insurance is a totally different subject in itself, and you keep learning, and they get you somewhere. So, every year the open enrollment starts in November.
Right.
So, I think every patient, Medicare eligible patient, should start shopping or planning the month before. So, you have two kinds of Medicare. One is Medicare HMO, and traditional Medicare with a supplemental plan. So what is Medicare HMO? Medicare HMO is one like Humana and United Healthcare, Cigna, where the patients have copay and they have out of pocket of $7,000 average, where until you meet $7,000, that is the insurance will pay 80%, and the patient pays 20% until they meet $7,000, after which it is covered at 100%. And each time they go to any doctor, like as Jigar was saying, they go to a oncologist, a blood doctor, an internal medicine doctor, a rheumatologist, because you have a lot of problems, right?
Right.
They have to pay copay at every visit, and it becomes very pricey. And the patients don't think about those things. So I would strongly recommend, instead of getting a Medicare HMO plan, just stick with Medicare and get a supplemental plan.
Okay.
A supplemental plan with good, like Plan F. It's pretty good, and you don't have copay. You don't have all this. You can go 95% of the things that you go for care is covered at 100%.
Right.
So even when you're hunting for a supplemental plan, there are many kinds. You look for one that is really good, and you have to pay some premium for that.
Right.
Like $250 average. But if you add up $250 into 12 months, it comes out to $3,000. So you come out good. You don't pay. Whereas the deductible here out of pocket was $7,000, and then you're paying copays every visit, $45. It adds up to $16,000 if you're really sick. So you got to think about those things, and then sometimes you can get a Medigap insurance where the gap is covered for that 20%. When you're retiring in 5 years, 10 years, you can get that Medigap insurance where once you retire, they pick up the premium for that supplemental plan. So you're not paying out of pocket for that. So you can plan ahead. Then coming to the younger population, or patients less than 65 years age, where they have private insurance. And then here, most of them are employed,
right.
and they have it through their work. And if it's you're working for a big corporation, that's pretty good. I would recommend them to get high deductible plan, because you can get a health savings account,
right,
and invest in that. Yeah, and invest in that in an index fund, and it keeps growing.
Right.
I would tell them not to use that fund until they retire, because once they retire, they can use that money to pay for the premium for the Plan F, the Medicare supplemental plan.
Right.
It pays for that, so you can plan ahead. Unless you need it for something earlier, that's fine. Coming back to your question about out-of-pocket deductible, when you're working for a big corporation, yeah, you will be okay, $5,000-$6,000. The purpose of medical insurance in the United States is for major illnesses. Something catastrophic happens, and you get admitted to the hospital, and then you can be cared for. But the biggest problem with this in this country, and no candidate, neither Trump or Biden, talks about, is if the breadwinner on whose job, the medical insurance is dependent for the family. If he gets sick, you lose the insurance. He or she.
Right.
Thank you. My daughter is saying he or she.
They're listening. That's really good. The young generation is learning something.
Right.
That's amazing.
So if the breadwinner gets sick, on whose job the family is dependent on for the insurance, you lose insurance. This is a really, really, really bad thing.
Right.
That is when the family needs support, and then you lose the job. Then you have to get Cobra coverage.
Right.
And nobody seems to care about that and talk about it.
Can you tell us a little bit about the Cobra coverage? Since you mentioned.
Cobra coverage is when, say, somebody loses a job or gets sick and they end up in the hospital, and after 3 months the company says, we can't let him stay on payroll, and they lose a job. Then the family has to pay like high premium, $1,800, $2,000, $2,500 a month to continue that coverage, which is, I think, good for 18 months.
Okay, right.
Not more than that. Then you have to find something in between.
Okay.
Some other job, or somebody else needs to start working, and then you have this issue of pre-existing coverage, illness. I mean, I don't understand. I mean, I don't know if I'm deviating a lot. Medical insurance like Blue Cross Blue Shield, United Healthcare, Cigna, these are all private payers. They operate under a profit motive or profiteering motive. They have a stock.
Right.
Humana is $400. United Healthcare is $300. I personally feel medical insurance should be for the good of the people of this country, or anybody, any country, and it should not operate under profit loss. It should be able to take care of everybody and also not suffer a loss.
Right.
And provide the maximum coverage it can provide to its. That's how you want to take care of your family. The country should take care of its people.
Right, I agree. And I think since the pandemic has started, many people are, suffering because of jobs, and so many are unemployed right now. Don't have insurance right now.
Exactly.
So
actually, I mean, believe me, Ramchandran, Ms. Smita, I was actually totally forgot about this meeting, and I was telling Jigar, I was thinking about starting a cooperative society or company, just like an hour, 2 hours ago, where he was telling me, how many things are you going to do? He was just telling me, you're so tired already. I wanted to group all the small businesses, his practice, my practice, hair salon, the gas station guys, Patel Brothers, Indian stores, all these people, they have to go on their own to get insurance.
Right.
And they have to pay a huge premium. The only reason they have to pay a huge premium is because they're a small business.
Right.
I mean, if I was running Blue Cross Blue Shield, I would automatically say, hey, let's batch all the small business guys under one group and give them a good deal.
Right.
But they don't do that. They don't do that. They just see each one as an individual thing and charge huge premium. So I was thinking, we need to batch them together, set up a separate LLC or a cooperative society, and then get a good deal from the insurance companies, and then let them have insurance. So it should save them at least 50% of what they're paying now.
Right. That makes that really sounds good. So Dr. Jigar, I would like you to elaborate that too, what Dr. Ganta just said.
So one example is there are two ways of looking at it. Coming back to the senior population, you have traditional Medicare, and then there is something called privatization of Medicare. Privatization means there are managed care or advantage plans of Medicare, which have become quite popular. So some of the examples in Tennessee are Cigna, HealthSpring, Blue Advantage, Blue Care Plus, Medicare Humana, Medicare Aetna. So as Dr. Ganta had mentioned, these insurance plans pay for 80% after your copay and after your out-of-pocket is met, and then after your copay, and then for the out-of-pocket purposes, you are stuck with 20% fee every time you get assessed or seen or have a procedure done. Premiums are quite affordable for these plans. So then the question is, if you're looking for an insurance, how would you go about deciding which plan is good? I have some of my distant relatives who are having advantage plans, And I also have patients who have Advantage plans and Medicare traditional plans as well. So the best and the most convenient plan for a senior is to have a traditional Medicare in this day and age, plus have a good supplemental plan, as Dr. Ganta had indicated. So Plan F is where Plan F as a supplemental plan is where everything is covered. You just pay the premium, and then you can see the doctor 1,000 times in the coming days, and you don't have to pay anything out of pocket for that particular year. However, Plan G is a little bit cheaper. The only thing the patient is responsible in that plan is the Medicare deductible, which is $198 for year 2020. Each year it goes up, but it still stays under $300 to the most part. But by paying $198 premium, $198 deductible, if one can save $400 or $500 in their premium, then it's worthwhile deal because every other benefit is the same.
Right.
Now going back to Medicare Advantage plans, I'll give you an example, a real life example. Somebody with colon cancer gets chemotherapy plus targeted therapy. So targeted therapies, immunomodulators, those are quite expensive treatments per cycle. So they had Medicare Advantage plan. They had to pay copay every single time they came to the office or they saw a doctor. So $35 copay, and see if on an active treatment they are seen about 5 times a month, for example, for various reasons. So that's 35 times 5. Plus they have out of pocket, so about $2,000 or $3,000 out of pocket. So that's an out of pocket expense plus the nominal premium that they have paid. And because of the targeted therapy, which is considered a specialty drug, per cycle, their cost on the treatment, this is above and beyond copay and out of pocket, their cost was $900 per cycle.
Okay.
So for 3 cycles, their expense, even after meeting those traditional expenses, was $2,700 extra out of pocket. So going back to the original point that me and Dr. Ganta were making, that sometimes those hidden expenses are more expensive than the upfront premium. And paying an upfront premium as we get older it seems to be a safer way to make sure that coverage is complete and full and out-of-pocket expense is minimal. And plus, a lot of the Advantage plans, they are in-network and out-of-network structured. So from the referral standpoint of view, traditional Medicare plan, you can go and see any doctor that you like. But some of the Advantage plans, they will limit you to in-network only. So for example, in Tennessee, most of the plans will limit you to the area of your residence. So like Clarksville, Tennessee, for example. And some special circumstances would need to be met if they have to be referred to Nashville. So it takes away the autonomy from the patient as well. And then there is a whole different component of prescription coverage because prescription coverage can be quite expensive. It's important to ask the right questions when looking for the correct insurance. That what is the formulary, what drugs are covered. If you already have certain illnesses that you're taking medication for, make sure you ask the insurance that, hey, are this medication going to be covered? And if they are, then what would be my share of expense? And what would the insurance pay in terms of percentage? Sometimes some of the prescription coverage plans would not allow branded drugs, and then you're stuck with generic. That can create some issues depending on what illness one has and what side effects they're getting from that particular drug. So those are the things that I would recommend, in terms of doing the research. And as Dr. Ganta had indicated, start a month or 2 ahead before the time comes. And then one other important aspect that I would like to add is we see this problem occurring on a routine basis. So when a commercially insured patient transitions to Medicare, so what happens is either they go to a traditional Medicare and then get a supplement, or they transition to one of the Advantage plans and then keep a secondary insurance. Right. So there is something called coordination of benefit that needs to be done. One would assume that it will automatically be done when you switch the insurances, but that doesn't happen. So what do I mean by coordination of benefit? So what happens is when Medicare takes over, there is always a delay in discontinuing the insurances. So the previous insurance still comes up listed as their primary insurance. Okay. So even though Medicare becomes primary insurance, when you send the claim, Medicare will say, hey, listen, I'm not the primary. The patient still has that old commercial insurance as primary. When you send the claim to the commercial insurance, they'll say, no, Medicare is the primary. So patients, I would highly recommend for individuals to call their respective insurances, Medicare and the secondary, and notify them who is primary, who is secondary. So that way, it will avoid a lot of unnecessary hassle on the tail end of the problem.
Right. That's a lot of good information. I'm sure people will benefit. So I would now, since the pandemic has started, a lot of elderly people especially are skeptical to go to the doctor's office, because they are scared of getting exposed or something. So what is your opinion about telehealth, where you can, do a FaceTime with the doctor, without visiting, you can have a doctor's visit. So I would like to start with Dr. Ganta. What do you like? How do you feel about telehealth?
Well, telehealth is a good development. I think it is definitely useful for minor illnesses or for a known patient. For chronic management of a known patient on a problem like diabetes, hypertension, and all that. But if the same patient is having an acute problem, they need the doctor's visit and a doctor's assessment for physical examination. It could be something very important, where some tests need to be ordered based on that examination. Yes, for elderly patients, I understand, the chance of them getting sick is high. So telehealth should be one of the priorities for a regular visit, not a sick visit. Then even for a sick visit, maybe they should do an initial televisit and then make an assessment and see, okay, if you need to come in, then please come in, we'll go from there, kind of thing.
Right.
That's how I would approach it. So my question is, do we have viewers from India too for this, or just US?
No, India too.
So I just got an app. Somebody forwarded something to me by WhatsApp, where the Narendra Modi government has started an app for elderly patients, where they don't need to go to the doctor.
Right.
And I don't know. It's called eSanjeevani, and then you can have a visit with a provider designated to the government, and then they also send a prescription to the pharmacy without even having to step out of the house. Here the government has taken the initiative to provide a free service to people in India, especially elderly patients.
Wow, that's great.
Yeah, but we don't see that in the US.
Right.
In spite of the pandemic. Yeah. So it is a good thing. I think we'll probably see more of it. And it will be a good addendum for the care of the patient.
Right. So just out of the blue, like if anybody does not have healthcare insurance, when they get tested for COVID, they pay out of pocket?
Yeah, they have to pay out of pocket. So I can see if somebody doesn't have insurance. I see a lot of patients sometimes who don't have insurance. I don't charge them anything. But that is just one part of the medical care, right? You write a prescription. They'll have to go to the CVS pharmacy or some pharmacy. They have to get those medications. They may need blood work. That costs money. They may need a chest X-ray or a CT scan. That costs money. So there's so much expenditure here involved, just not a doctor visit.
Right, right.
So you have to think about all those things too.
Right. So, Dr. Shah, my question for you is, since the pandemic has started, and we always hear that it's very for diabetes patients, for people with breathing issues and all, COVID is a little serious. So, what about cancer patients? Like, how fatal is COVID-19? For people who have cancer.
And I'll address that question. Thank you for the question. But I want to add something to your last question.
Right.
In terms of COVID testing. I don't know about South Carolina or any other state, but at least in Tennessee, a lot of the health departments. So in our own county, Montgomery County, the health department testing is without any charge. And if somebody is tested positive, then medical care is provided by the local institution who is in charge of treating COVID without any questions asked at that point, because it's a public health issue, and at least at this point, government has provided the provision for those patients to be treated if it's related to coronavirus illness. So coming back to cancer patients, so if we look at all the published data, of all the cases that have occurred in United States, for example, there is very little mention of cancer patients involved with the coronavirus. As you had mentioned, chronic diseases such as diabetes, kidney disease, and end-stage lung disease, those are coming out to be more prominent comorbid factors in leading to complicated coronavirus course. There has not been much said in terms of why that is the way it is. That also does not mean that cancer patients do not acquire coronavirus infection. If a person is immunosuppressed in either way, and I would go to the extent that even stress, if somebody is extremely stressed, then that can also cause a similar situation as an immunosuppressed state, where a person may be more liable of acquiring opportunistic infections as well as coronavirus infection. But overall, cancer patients have not been the focus of attention during this. So to go back to your previous question as well, is it safe to attend your regular appointment? And about the telehealth. So telehealth is all well and good. I think it's an excellent step that government has taken during this untested times. However, I would encourage everyone that if you have to see a physician, whether it be for oncology reasons or for your diabetic care or for any other reason, I would encourage you to keep that appointment. A lot of physicians' offices are taking all the precautions as guided by Center of Disease Control, and I wouldn't doubt the safety in those areas. Actually, outpatient practices sometimes are much more safe compared to inpatient facilities. So if you are required to see your doctor for any particular reason, please go and see them without any hesitation. And for non-urgent cares, telehealth is all well and good. Oncologists have not stopped practicing throughout this pandemic, and patients who are getting treated, they are benefiting from the treatment. The problems are occurring for the patients who are missing their appointments because of the fear of coronavirus, because that leads to the disease progression. So somehow the mortality among oncology patients, as per currently published data, does not seem to be statistically significant. And because of that, I would encourage whoever is getting treatment, wherever they are, to continue that without any hesitation and continue to abide by the Center of Disease Control guidelines in terms of social distancing and sanitization procedures.
Right, right. I would also like to ask, how does a deductible and co-insurance of healthcare plan apply to COVID-19?
So, do you want me to answer that first?
We can ask from Dr.
Okay. So,
well, yeah, with the current guidelines, most insurances have waived the co-insurance and co-pays.
Okay.
At least for primary care.
Okay.
Not when you're seeing a specialist.
Okay.
Yeah, co-insurance and co-pay has been waived, and the testing is free.
Right.
As long as insurance, if the patient has insurance.
And treatment as well?
Well, the treatment is symptomatic. If you're so let's talk about COVID. COVID infection is a viral infection. There is no as such medicine for that viral infection.
Right.
The problems arise when you develop a secondary infection as a result of the COVID infection. And some people may not have any problems. Some people may have slight sniffles. Some people may have fever, cough, congestion, and
right.
you're taking Tylenol, cough medicine, and some antibiotic. And some are getting very sick and ending up in the hospital. And that, if you're in the hospital because of COVID and COVID-related infections, opportunistic infection as a result of COVID, you get secondary bacterial infections, respiratory failure, and other problems. That is covered. The government, so there's no charge for the patients because they're covering it at 100% during this. Because there is this, when a health emergency is declared in the country, then I think it is till end of December, as of if my memory and my information is correct. So there shouldn't be any problem. Yeah, that's how it is.
So just an opinion from both of you. What do you think is the most promising treatment so far for COVID? Just what do you think as a physician? Dr. Shah.
So first of all, there are treatments with FDA accelerator approval, like remdesivir in United States for sick patients. But however, there is no final word on a particular treatment that is more effective than the other. Recently, current administration approved an emergency use of plasma therapy.
Right.
That seems to be historically more promising. And what do I mean by historically? So there have been pandemics in remote past in United States as well. So if we gather the data from United States as well as from the rest of the world, then plasma therapy has worked because you are giving an immune generated plasma to an infected patient, where the immunity that has developed in the plasma tries to resolve the infection in that infected patient, to put it in a layman's term. But again, FDA is still yet to come out and make a consensus statement. Even though it's been approved under emergency position, I don't believe any authority anywhere in the world has come out and said that is the treatment. But in lieu of any definitive treatment, I believe plasma therapy, if it's available in the area, then that should be employed because it seems to have more promise until we have more data from the currently ongoing trials.
Okay, that's really good. So also, can you tell us a little bit about antibodies test? Like, what is that?
For coronavirus testing, recently they approved a rapid antigen test.
Okay.
And rapid antigen test is a very familiar technology that has been available for many years, and it has been used to test other types of infection in the past as well. The benefit of rapid antigen test is the sensitivity. So what do I mean by that? If you are positive with rapid antigen test, then it becomes a true positive. The problem occurs with the specificity, meaning if you are negative, say if somebody has a rapid antigen test done, and if they came back negative, but if they are still symptomatic, then I would not recommend terming that patient negative for coronavirus. If they're still having symptoms, Then we have to go to a next step where they are doing RT-PCR, so polymerase reverse transcription polymerase chain reaction test, where they amplify the molecule or the DNA of the virus, and it becomes more specific. So if somebody is positive with RT-PCR, then that is the meaning that they are truly positive and they need treatment of whatever is available in that circumstance. So the message I'm trying to say is, if somebody is having symptoms of coronavirus, they get tested either in the emergency room or by primary care or by health department with rapid antigen test. And if they're negative but the symptoms are still persistent, then that individual needs to be tested for RT-PCR, because that becomes more of a confirmatory test. And then going back to your antibody question, so say if somebody got infected, they got better, then in that scenario, antibody testing is useful to identify which patients could be plasma donor, because that particular individual has developed an immune response to the infection that they may have been exposed to. So in that fashion, that test becomes very helpful. Sometimes in an acute setting or in an acute infection, antibody test could be negative. So I would not use that as a screening test. But if we are looking for plasma donors, then that becomes quite helpful. If we are trying to establish a database, who was infected but was asymptomatic, and yet they have developed antibody, then that test becomes very important.
Okay, sounds good. Dr. Ganda, do you think in fall we will see a spike in cases, since we will have our flu season as well? And do you guys recommend that everyone should take the flu vaccine this year?
Okay, good question. Answering the second question first, I already started giving flu vaccine to everybody in our office.
Okay.
We just started this Monday or Tuesday.
Okay.
To answer the question, hold on. I'm sorry. So just to answer the question, the previous question where Jigar was answering about antibody and the COVID testing, I completely disagree with what is happening in this country and everywhere else.
Okay.
Nobody is going to go to a doctor if you're not sick.
Right.
So why are we doing COVID testing when you're not sick? Number one.
Right.
Two, if you're sick and you're going to the doctor's office with cough congestion, you're testing for a flu. When I'm going back to flu, right? And if they are flu positive, then you put them on the treatment for flu for 5 days. That too in the very early stages. Here, if it is COVID test positive, like Jigar mentioned, remdesivir was approved. I'm not going to, if you're walking, talking with low-grade fever and without any immune compromised situations like multiple medical problems or poorly controlled diabetes, I won't go order a COVID testing because there is no approved treatment correctly. And they're testing everybody. So if you have a test positive, then you'll just know the test is positive. Then that's it, right? You're not doing anything about it.
Right.
So I would do COVID testing only if somebody is really sick. Have you to go to the hospital? Yes. Do test for them, and if they need hospital level of care, I would have compartmentalized the ER, which should have happened in the United States long back and everywhere, where if you're suspecting COVID, they come through a separate channel and get tested, or go through a separate process. Like cancer patients should go through a separate process, and other patients should go through a separate process, like heart attacks. But they're testing everybody. I don't know why.
Right.
And everybody's talking about the spike in the fall. Yeah, let there be a spike, but how will you know that there is a spike? Only if you test, right? But if you are walking, talking, doing stuff normally, why should we go and get tested? If you are very sick, yes, please be tested, and then take the precautions. And there is a mask mandate in most states now. Like we came to Atlanta today, and we have been wearing masks here as we were entering the state, and it said on the highway, interstate, put your seat belts and like the regular advisory.
Right.
Then the mask, they were encouraging, please wear a mask. So we just take those precautions. And if things are getting bad, you're having high fever, cough that's not getting better, yeah, please, we need to test those people. And then if he's positive, then take care of the family and the things people he was exposed to. But I wouldn't test all these people, the waste of money. And then coming back to your question about the treatment, they're doing these multiple trials for coronavirus vaccine, and the virus will mutate by the time they come up with a vaccine. And I don't know,
You think, I mean, there's been such mixed feelings about, whether some people want to take the vaccine, some people are not comfortable. So, first of all, I don't know how easily it will be available once it's out in the market for common people. So, what do you think?
Well, there are trials going on. Anybody can participate in this vaccine trial, and they actually get paid $1,500 to $1,800. If they participate in the trial, they have to go a total of 5 to 6 visits. Each visit is like, first visit is 2 hours, subsequent visits are 1 hour. Each time they go, they get paid. But the vaccine is a vaccine. Coronavirus is a virus, and the infections are from bacteria, and we have antibiotics for that. As you know, there are so many viruses. There is no specific antiviral treatment. We had polio virus. There is a polio vaccine.
Right.
We should really thank the scientist who, Mr. John Salk, I think he's an American, who came up with the polio vaccine. He has not charged a single cent and made it available to the whole world for free.
Right. Well, people have a lot of questions, how much is it going to cost? And
No, vaccine will be covered by insurance.
It will. Okay.
Yeah, because like flu vaccine is paid at 100%. I think coronavirus vaccine will be covered. I think I read the news item somewhere, maybe $35 or $40 total, but I think it should be covered by the insurance at 100%.
That's great.
Yeah.
So, Dr. Jigar, what would you like to say about the vaccine?
So, first of all, to going back to your question regarding influenza, so there is no cross-reactivity documented thus far in terms of coronavirus versus influenza. My practice pattern has been that why complicate the issue? Because right now, even if you sneeze or cough in public place, you have coronavirus. That is the general psychology of general public. So
it's a fear.
It's a fear. So if you were going to get flu, and if you have flu-like symptoms, you are going to be termed coronavirus until proven otherwise. So then, keeping that in mind, I usually recommend to my patient population to take all the CDC recommended vaccines. That includes pneumonia as well as influenza vaccine. So if they're due for pneumonia, then that's fine because it's every 5 to 10 years. And then influenza is every year. So especially the senior citizens, which are more talked about with coronavirus, and immunosuppressed patients, or people with chronic diseases that are listed in terms of diabetic and kidney disease and lung disease. So that's number one. Number two, coming back to coronavirus vaccine, again, I believe the targeted population should definitely be given that vaccine. As Dr. Ganta had mentioned, insurances will be made to cover. That's my feeling. Again, government has not said anything. But just like coronavirus testing, I believe insurance will cover it, and then probably government may subsidize it where the out-of-pocket expense of the patient may be forgiven, just like with coronavirus testing that government is doing. But at least the immunosuppressed patients or immunocompromised patients or senior citizens or high-risk patients should definitely be given. The efficacy of the vaccine, currently available data indicates that there is this vaccine coming out or is being tested in Great Britain by a company named AstraZeneca. I believe that was the first one to report that they have started testing. And that shows a lot of promise. They also have testing trials for that particular vaccine in India as well, Pune being the heart of infectious disease in India. Yes. So I believe I don't think any government will just release the vaccine. Contrary to the rumors that are outgoing. I believe every government, whether we like it or not, they act with responsibility and in the interest of general public. So I encourage for people to take vaccines, even the younger patients or patients who are considered traditionally as low risk. Historically, if you look at the data with polio vaccine or any other vaccine, influenza vaccine and so forth, very rarely you have any life-threatening side effects from vaccine. A lot of the times you may get flu-like illness or you may get short-term illness, but very rarely you see high mortality. So my question would be, what do you have to lose? On one hand, you have a virus where effective treatment is yet to be confirmed. Then why not take preventive treatment? Because at least you have some percentage chance that you may not get it, or your course of infection may be less. So I would encourage people to take it, and that's one of the ways to get herd immunity. They talk about herd immunity in news right now. So what is herd immunity? You have to make sure that everyone develops immunity in a quick format so that we can prevent the complications and the high number of deaths that we are seeing right now.
Right.
So if people did not take the vaccine, then that particular aspect would not be accomplished, and the infection will still keep on flourishing. And and there is always going to be some failures with vaccine. We have to understand that, and we have to accept that, because each virus mutates as we even speak. So God knows when the vaccines are actually approved, what will be the status of the virus and what strain we will be dealing with. So none of the vaccines are expected to be 100% effective. But hey, at least if we get a higher percentage of effectiveness, they're still better than what we are getting right now.
Right. Yes. Right. Definitely. This was a great discussion. So before we leave, would you like to give our viewers any message or any other topics that you guys like to talk about before we end the session?
So thank you. First of all, thank you for hosting this. I hope viewers will benefit from this conversation today. Again, my final message is, if you have illness and if you are required to see your doctor of whatever specialty or primary care, please don't hesitate. Medical offices are safe to most expect. Again, nobody can say 100% about anything nowadays, but if you need the physician's visit, then go and see them without any hesitation, as long as the office is open. And I would not recommend delaying your care. It does not help delaying treatment for your illness. It's only going to harm. So that's my 2 cents worth on this topic.
Thank you so much, Dr. Jigar. Thank you so much for taking the time out today. Dr. Ganta, especially you are with your family and you are on a trip right now, but you took the time to be with us. We really appreciate it. So we would like you to also give our viewers some message.
Thank you for, sure. Thank you for having us on the show, and it was really great to participate. I hope I know the viewers have benefited at least some extent from what we have discussed.
Yes.
As Jigar said, there should not be any hesitation going to the doctor's office. Just like you go to the hospital, you are getting sick, you go to the hospital. Same way, when you come to the doctor's office, you're able to walk out. Just wear a mask, maintain social distancing, and use hand sanitizer, and get the medical care that is needed. And I've not shut down the office during this time. We have been going full steam. And then plan, for the viewers in US and also in India. In India, we have a long way to go because we are 70 years behind.
Right.
But there's no medical insurance.
Population.
Not the population. We can get into that later. There is no planning, about Medicare. The current prime minister at least started Ayushman Bharat. That's a great start. He's doing a great thing. He's wonderful job, and hopefully we will develop and provide coverage for everybody. So plan before you get the insurance. November 1st is enrollment. So for Medicare patients, please plan ahead. Because this is September, October, so you have 60 days. So plan from now. You have the Google, you have internet, you can search everything, and then take the right insurance and plan ahead. and go from there. And I hope everybody stays healthy, stay safe. Take necessary precautions.
Thank you so much. Thank you, Dr. Jigar Shah, and thank you, Dr. Pramod Ganda, for taking the time out and being with us tonight. Before we leave, I would like to just tell our viewers quickly about our Bharat Got Talent, which is a talent show open worldwide. No age limit, lots of categories. If you have the talent, we have the platform. So do send us your entry and keep watching My Dream TV USA. Thank you so much and have a wonderful night. Good night. Thank you.
Thank you.